Electrical axis of heart or cardiac axis is the mean of all four vectors of ventricular depolarization, that is mean of the QRS waves of ECG. The electrical axis of heart depends on the direction of the depolarization and the position of the heart. The diagram shows that there are two distinct electrical fields. This one is negative field and this one is positive field. The negative field starts with 0, minus 30 degree, minus 45 degree, minus 90 degree, minus 135 degree and minus 180 degree. On the other hand, the positive electrical field starts with 0 degree, plus 45 degree, plus 55 degree, plus 90 degree, plus 110 degree, plus 135 degree and plus 180 degree. In this diagram, R denotes the right side of the human body and L denotes left side of the human body and F denotes foot side of the human body. These R, L and F together forms a triangle which is known as Einthoven's triangles, and in the center of the triangle heart is located. And we all know that heart is made up of myocyte cells, and there are specialized cells in the atrium which is known as pacemaker cells or SA node or sino-auricular nodes. And these SA node or pacemaker cells generate cardiac impulses, and these cardiac impulses conducted to the whole heart and through AV node, bundle of His and Purkinje fibers. And this impulse generated in the SA node causes contraction of the heart and relaxation of the heart, that is systole and diastole. And this cardiac impulses causes generation of the 5 vectors, and the electrical axis of heart or cardiac axis is the resultant of these 5 vectors or ventricular depolarization, or it is also called mean of the QRS waves of ECG. Now this is the 90 degree electrical field. This is the 30 degree electrical field. This is the plus 90 degree electrical field in the positive field, and this is the plus minus 180 degree field. Besides, there are 12 leads which is required to record the electrical activity of heart during echocardiography or ECG. Among them, there are 3 standard leads or bipolar limb leads, that is lead 1, lead 2 and lead 3. Besides, there are 3 augmented limb leads, that is AVR, augmented vector right, AVL, augmented vector left and AVF, augmented vector foot. Finally, the lead present in the chest, which is known as unipolar chest leads V1, V2, V3, V4, V5 and V6. These 12 leads is required to record electrical activity of the heart during ECG recording. Now, if the resultant vector or mean of the QRS waves of ECG or the electrical axis of heart or cardiac axis is located in this region, that is started with minus 30 degree to minus plus 90 degree, then the electrical axis is called normal electrical axis or normal axis. Suppose in an healthy human or healthy heart, the normal electrical axis is plus 55 degree. So if the electrical axis suppose lies on this area, that is 35 degree, plus 35 degree. So there is a deviation is minus 10 degree, and the deviation is on the left side. On the left side, if the deviation is on the right side, that is called right sided shifted, and suppose this is the 80 plus 80 degree. So there is a deviation of 20 plus 25 degree. So there is a deviation is right sided deviation of 25 degree. Next, if the electrical axis of heart is lies on between minus 30 to minus 90 degree, then the electrical axis of heart is called left axis deviation. Suppose this is the minus 80 degree. So minus 80 degree is left axis deviation. There are various reasons for left axis deviation, such as shifting of the heart towards left due to any reason, left ventricular hypertrophy, left bundle branch block, anterior division of left bundle branch block, or left anterior hemiblock. Next, if the electrical axis of heart is lies between plus 180 degree to plus 90 degree, then it is called right axis deviation. Suppose if the electrical axis is lies in this area, so this is 130 plus 135 degree. So this 1 plus 135 degree indicates that an individual is right axis deviation. And there are various reasons of right axis deviation, such as shifting the heart towards right due to any reason, right ventricular atrophy or right ventricular hypertrophy, right bundle branch block, posterior division of left bundle branch block, or left posterior hemiblock. And finally, if the electrical axis of heart is lies between minus 90 degree to minus 80 degree, minus 180 degree, then the electrical axis is called extreme deviation or northwest axis. So there are 4 sections, that is normal axis. This region is left axis deviation, which is started from minus 30 degree to minus 90 degree. If the electrical axis lies between minus 90 to 180 degree, this is called extreme deviation or northwest axis. And if the electrical axis lies between plus 90 to 180 degree, plus 180 degree, then this is called right axis deviation. Now the diagram shows the lead 1 and ABF and QRS pattern of normal right axis deviation and left axis deviation.